This is Claire and her dog Stella. Claire has been worried for a while because Stella's health seems to have deteriorated recently. She's thinner, thirsty all day, urinating more and losing weight, but her appetite is still good. Dogs that exhibit these signs could be suffering from diabetes. But how does diabetes occur in the first place? Food that people or animals eat is broken down in the stomach first and then digested in the small intestine, where it's absorbed to be used in the body. One of the substances absorbed is a type of sugar called glucose, which is carried to the organs and muscle cells by the blood. In a non-diabetic pet, insulin, a regulating hormone produced by the pancreas, allows glucose to enter cells where it is used as fuel. In diabetic dogs, the pancreas does not make enough insulin. Their cells do not receive enough glucose, and too much glucose remains in the blood. Since Stella is diabetic, her kidneys filter glucose from the blood, but are unable to reabsorb all of this glucose. Instead, it is eliminated from the body through the urine. As a result, Stella has to urinate more, which in turn makes her thirstier, so she will drink more. Because the body's cells cannot absorb the glucose, Stella does not have enough energy. And as a result, Stella starts to eat more. However, since she cannot utilize the glucose, she will continue to lose weight, and her condition will continue to deteriorate. Basically, diabetes in most dogs results from the body's inability to produce insulin. Thankfully, we can overcome this. We can administer insulin. Sounds like it's time for a trip to the veterinarian.
These signs could be caused by other diseases such as kidney failure, so to be sure, we'll take some urine and blood samples. First, we'll test Stella's urine, and if it's positive for glucose, we'll take a small sample of blood to check her blood glucose levels and confirm the diagnosis. To complete the blood test, we need a small sample of blood to check her blood glucose concentrations and to rule out other conditions that are common in dogs. This can be done in a variety of ways. Today, we'll take a sample from a vein in her leg. Many of the tests need to be analysed in our laboratory. While we're waiting for the results, we can collect a tiny drop of blood from her ear flap and use our glucometer or glucose meter. We may use this method to monitor her progress at home. If the results are above those that we expect in a non-diabetic animal, then we may be looking at a diagnosis of diabetes mellitus. We'll confirm this using the results of our additional tests. To treat diabetes, we need to administer insulin. We're going to use Caninsulin, which is specially developed and prepared for use in dogs and cats. Caninsulin should be administered once or twice daily to dogs, depending on what they require. Most dogs will eventually need injections to be given twice daily at 12-hour intervals. Some dogs merely need a dose once a day, as proposed on the product label for starting treatment. One way to administer Caninsulin is with a traditional U40 insulin syringe. We'll use a very fine needle that Stella will hardly feel. But first, we have to prepare the insulin.
According to the most recent label advice for this product, it is important to shake the bottle thoroughly to ensure the insulin is uniformly milky, especially before using the bottle for the first time. Turn the bottle upside down, remove the needle cap, and pierce the rubber stopper. Then withdraw insulin into the syringe. Then gently flick the syringe to move any air bubbles to the top of the syringe. Next, remove the air bubbles and make sure that the plunger is level with the required dose. Caninsulin is injected subcutaneously, which means under the skin and not into a muscle. First, pinch up a little bit of skin along the side of your dog's body. You'll want to alternate body location and sides each time you inject. Then, introduce a needle at a slight angle to its full length. Depress the plunger and deliver the insulin under the skin. and then withdraw. See how easy that is?
Once you're done, be sure to store Caninsulin upright, not on its side. Protect the vial from heat and light, and you may find it useful to keep the Caninsulin in the refrigerator. Another way to administer Caninsulin is with the vet pen. Vet pen is reusable and lets you easily and accurately select and deliver the proper dose.
To prepare a vet pen already loaded and primed with a Caninsulin cartridge following instructions, screw on a new needle before use and mix until the insulin appears uniformly milky. To remove air from the needle and check the vet pen is working properly, dial 1 unit on the dose selector. Holding the vet pen pointing vertically upwards, push and hold the release button down fully until the arrow points to the start line. Insulin should drip actively or squirt out of the needle tip. Next, select the number of units that have been prescribed by your veterinarian by turning the dose selector carefully. You can inject your dog along the side of its body, in the area from behind the shoulder blade to the middle of the lower back. Insert the needle through the skin and push the release button down fully. Hold the button until the dose selector has returned to the start line. Then, count slowly to 5 to allow the injection to be completed and remove the needle from the skin. Once you're done, follow the instructions provided to store the loaded vet pen.
I'll determine the number of units that Stella needs to start with. Then I'll examine her at regular intervals and I can review the notes that you've made of her progress. And using this information, I can adjust the dose as needed until she's properly regulated.
In animals that are poorly regulated or need further investigation, hospitalisation may be necessary for a day or so. This allows your veterinarian to test blood glucose every 1 to 2 hours to get a clearer picture of what happens over the course of a day.
Once Caninsulin starts to work, Stella will return to normal. If her diabetes is well regulated, she'll be a much happier dog.
It is important to stick to a routine that includes regular meals and exercise. It is common practice to feed part of the daily ration in the morning, around the time of the insulin injection, and the rest of the daily ration about 8 to 12 hours later. If your dog is overweight, your veterinarian will advise you on how to feed it to help it lose weight. There are special diabetic diets available for dogs, some of which are high in fibre that can be very helpful in regulating diabetes. Too much activity, excitement, illness or stress can lead to loss of regulation. In particular, a relative overdose of insulin can lead to a lower than normal blood glucose or hypoglycemia. When starting insulin treatment, increasing the insulin dose or changing the insulin product, it's important to watch very closely for signs of hypoglycemia. The signs of hypoglycemia include lethargy, dullness, trembling, loss of balance, and in serious cases, seizures and loss of consciousness. Hypoglycemia can be a true emergency situation. You need to keep a source of glucose, such as glucose powder or corn syrup, on hand for emergencies. The powder can be made into a paste or solution with a little tap water. If your dog shows any of these signs and is able to eat, feed a small meal of its usual food immediately. If your dog is unwilling or unable to eat but is able to swallow, rub small quantities of your emergency glucose source into its gums. Do not force anything into your dog's mouth, as you may risk getting bitten. If you believe that your dog is suffering from low blood glucose, please contact your veterinary team as soon as possible. Your veterinarian may also show you ways to monitor your dog at home. Keep a record of any unusual signs and the results of any measurements you take in a diary, so you can report anything unusual to your veterinarian. This diary is also a helpful place to keep track of your dog's activity, water intake and eating habits. You may also choose to monitor your dog's blood glucose at home using a glucometer. This provides your veterinarian with additional information on how your dog is doing on its current insulin dose. You should record the results of each test in the diary. So remember, in order to keep your diabetic dog healthy at home, you should encourage a regular diet and exercise. Always be prepared for hypoglycemia. Monitor it closely and keep a record of any measurement you take at home. Dogs with diabetes can lead a happy life when you maintain a regular daily routine and they are regulated on Caninsulin. For more information about Caninsulin and VetPen, please visit www.cat-dog-diabetes.com.